Hello dentists, how are you today? Today we're going to talk about complications of teeth extraction. Okay, before we start our topic today, I want you to subscribe to my channel and hit the notification bell for more videos. Okay, what are the complications of teeth extraction? We have preoperative, then we have intraoperative, and then we have postoperative. Preoperative means before extraction, okay, which are the complications related to medical conditions or anatomy. Then we have intraoperative means of those complications that occur during the procedure, during extraction. Post-operative complications are those that occur following the procedure or following extraction. Post-extraction granuloma is the region of the left mandibular first molar. Here we have post-extraction of the granuloma in the region of the left mandibular first molar. We have here granuloma after extraction, okay? Pre-extraction complications. Let's start with the pre-extraction complications. What are they? First, we have difficulty in achieving anesthesia. So here we have a problem. Our first problem we have to tackle is difficulty in achieving anesthesia. So what are the reasons for this? There may be varied nerve supply or extensive infection or severe infection. Okay, this may lead to failure of anesthesia to deliver anesthesia. Okay, anesthesia in the correct location. Okay, so what do we do in this case? We give the patient antibiotics and then tell him or give another appointment, and he will come back for extraction after antibiotic treatment, okay, for 4 days. Then the second thing, we have poor cooperation. The patient may be uncooperative. Okay, this means he has anxiety or scared of injection. Okay, poor cooperation that takes place before extraction. That's due to lack of patient cooperation and which will make a barrier to effective extraction. Okay, here in this case this may lead to fracture of the root or other things may happen in the clinic. This is really difficult if we have a patient who is uncooperative. Okay, it's normally really irritating for the dentist to work with. The third complication here, we have complications associated with medical conditions. Okay, patient may have certain medical conditions may interfere with extraction. Difficulty in access, so like for example trismus, limited opening, okay, abnormalities in the joint, okay, which is an intrinsic factor. So difficulty in access also due to microstomia. Patient may come to the clinic with a small mouth opening. Okay, this is really difficult to extract the tooth. Let's see. So this, can you see here? Yeah, this patient has microstomia. Okay, can you see the opening is very small? Here we cannot reach. Can you see? It's so difficult for us to reach the lower wisdom teeth and even the upper molars. Okay, let's talk about the next thing. Secondly, we're going to talk about intraoperative complications of tooth extraction. What are the intraoperative complications of tooth extraction? These complications happens during extraction. Firstly, failure to complete extraction or fracture of the tooth. This is possible of fracture of tooth during extraction. Damage of other teeth. Yeah, they may after during extraction you might make damage to the next teeth. Okay, loss of tooth or roots. Okay, oroantral communications. Soft tissue trauma. There might be trauma to the soft tissue while extraction using the forceps. Forceps are really hard instruments. Damage to nerves. Okay, fracture of the alveolus or the mandible. dislocation of the temporomandibular joint, broken instruments. Okay, so these complications happen during extraction. So you have to learn these very well. Okay. Can you see here? We have here the root has slipped into the sinus. This is really a very terrible complication. Okay, root in the sinus. Okay, this is a radiograph of root slipped into the socket. Okay, and into the sinus. Okay, another complication while extraction is the tuberosity. Can you see here? If we're extracting the upper 8 or 7, okay, what happens here? This is a broken bone. Okay, can you see? Due to excessive force. Okay, so we have to take care while extracting the upper molars, because this may lead to breakage of the tuberosity. Can you see here? The bone comes out with the tooth. Normally this is not right, this is not correct, this is shouldn't be done. Okay, so it should be done slowly. Okay, and very well grippage of the tooth. Post-operative complications of tooth extraction. Let's talk about what happens after what are the complications that happen after extraction. After the extraction, we tell the patient to if he has slight infection, we can give antibiotics, and then he can come for checkup. We check up the socket. Okay, in this case, some patients may get post-operative complications. Okay, like for example hemorrhage, okay, bleeding, pain, swelling, dry socket, as we talked about it before in our YouTube channel. Infection, we have patient may come back with an infection, osteoradio necrosis, medication related osteonecrosis of the jaw, trismus due to long extraction time. Okay, this may lead to trismus. Okay, surgical emphysema. Okay, so let's look at some of the pictures here. So these are the post-operative complications of tooth extraction. It happens after extraction. Okay, so we can see here, this is here we have here. Okay, this is swelling. Normally this is a normal patient, but I want to show you here. This is how to check the infection or the swelling, periapical. Okay, let's look another one. Let's look at the other one. Here we have osteoradio necrosis. Here we have, this is after extraction. Okay, we have this is osteoradio necrosis, after necrosis of the bone after extraction. Here also this is after extraction. Okay, we have here, this is a dry socket, and we talked about it before. Patient coming to the clinic with a swelling. Now this is how to diagnose. Okay, clinically this is a swelling. Okay, so I hope today's topic was interesting, and subscribe to my channel and hit the notification bell for more videos. So see you in another video, and I hope that you liked it, and good luck to all of you in the clinic, and may God bless you all. Bye for now.